when we decide that we're ready, we want to start our family, we want to try to get pregnant, one of the first questions we ask is, all right, how can I increase my chances of developing a healthy pregnancy and fast, right? So unfortunately, a lot of this is out of our hands. You know, for various reasons, some women get pregnant, like they sneeze and they're pregnant. They get pregnant on their first try. Some perfectly healthy women take months and months and months and months to get pregnant, even if they have absolutely no fertility issues. Some women that are perfectly healthy have a pregnancy loss because of a genetic issue in the embryo that they have absolutely no control over. So again, a lot of it is out of our control, but there are things that we can do to make sure that our body is in the best position to support the development of a healthy pregnancy. So one of the major things we can do is to stop smoking cigarettes altogether, to curb any heavy alcohol drinking. So most care providers will say, you know, it's probably okay to still drink a bit of alcohol, but try to limit it to maybe just a few glasses of wine a week, for example. Or you might choose to just totally stop drinking alcohol, which obviously is fine. You also don't want to be using any recreational drugs. And if you're taking medications prescribed by your doctor, let them know if you're trying to become pregnant, and they can help you determine if your dosage needs to be adjusted, if it's totally fine to just continue on as is, or if you actually need to wean yourself off of that medication under their supervision. But again, do not just stop taking a medication or start taking a medication without running it by your care provider. Okay, speaking of talking to your care provider, it's also wise to have a physical when you decide to become pregnant, and to have a pap smear if you are due for one. And this can all help to confirm that you are in good health and ready to become pregnant. And you should also discuss your menstrual cycle with your care provider and confirm that it's like fairly normal, and ask if they recommend any blood work to confirm that your reproductive hormones are balanced. And because you'll want to discuss your menstrual cycle with your care provider, start actually tracking your menstrual cycle, so you have information to provide them. You probably want to start tracking ideally a couple of months before you go in for that appointment. And there's tons of apps that help you track your menstrual cycle and gather a lot of great information about it that will then allow your care provider to give you good information. And while speaking with your doctor, you also want to ask them about an exercise and dietary plan that would be healthy for you, especially if you have any special health circumstances like diabetes, for example. And they'll likely recommend that you get in at least 30 minutes of moderate exercise daily, and make certain dietary shifts that I'll get into in a moment, or at least meet certain dietary goals. In regards to exercise, unless you're like doing a crazy amount of exercise every day, they'll probably tell you to just kind of continue on with whatever exercise plan you're on. But again, if they suspect you have an exercise addiction or something like that, then they might suggest that you adjust it a little bit. But again, if you're not exercising at all, they will recommend that you start to build in a bit of that. Okay, so food or dietary goals that will help to potentially enhance your fertility and increase the chance that your body is ready to sustain a healthy pregnancy. So you want to increase your intake of fiber and get 10 or more grams of fiber every day. So some foods that are high in fiber include lentils, broccoli, berries, avocados, whole grains, apples, and obviously prunes. This is, again, certainly not a comprehensive list. And one of the great things about getting 10 or more grams of fiber daily is that in addition to helping you prevent constipation, it can also help to reduce your chance of developing gestational diabetes when you're eventually pregnant by 26%. So get in plenty of fiber. You also want to reduce your consumption of soda, really sugary drinks, like fruit juice. And research has found that women who drank 5 or more sugary beverages per week before they got pregnant were at a greater risk for gestational diabetes. And gestational diabetes can be a fairly serious issue during pregnancy, so we want to avoid it as much as possible. And it is helpful to realize that it's not just about your diet during pregnancy, but your diet before becoming pregnant as well that can impact gestational diabetes. Drink more water. This is pretty much like the recommendation for everything, for just like having a better life. Drink more water, right? So you want to drink a minimum of 8 8-ounce glasses of water, of purified water daily, and really more, especially if you're really active and you sweat a lot. You want to eat less red meat, processed meat, animal fats, and foods high in cholesterol. And you can replace that red meat, all of that kind of stuff with protein from foods like almonds, eggs, quinoa, black beans, and legumes. And there is plenty of other protein-rich, vegetable-based foods that can help you replace that protein that you're not getting from, again, things like processed meats and red meat. You also don't want to eat too much fish high in mercury, like swordfish or king mackerel. Cut back on fried, processed, high sugar foods. Caffeine, we want to limit caffeine intake to 20 milligrams a day, which is essentially less than 2 cups of coffee. The good news is you don't really have to cut out all caffeine. Research has found that even pregnant women, it's safe to have about a cup and a half, a little bit more of coffee or caffeinated tea each day without any adverse effects to the baby. And in addition to getting dietary and exercise recommendations from your care provider, ask them about your weight, because being under or overweight can impact your ability to become pregnant, because it can impact ovulation and levels of reproductive hormones that do things like prepare your uterine lining for the implantation of that embryo. You also want to start taking 400 micrograms of folic acid every day, and this can help to prevent abnormalities in the developing fetus's brain or spine. And you can get a folic acid supplement at pretty much any health food store, or really any store that sells supplements. And you can also start taking a prenatal vitamin that has 400 micrograms of folic acid. You can just go ahead and get that started now and just carry on into pregnancy. Sleep for at least 7 to 8 hours or a little bit more a night, and improve your sleep by investing in a really good mattress, bedding, comfortable pajamas. You want to make your room as dark as possible, and you can keep the air circulating, have it be cool, have some white noise in the background by having a fan going. You also want to ensure that your job doesn't expose you to harmful radiation or chemicals. You want to make sure you are getting care for any health conditions that you have. You really want to stay on top of that. And start a daily relaxation practice. So starting the day or ending the day, or doing both, by engaging in, even just 5 minutes of some deep breathing, some meditation, a little bit of yoga, journaling. It can really help you reduce your stress. And speaking of breathing, regularly check in with yourself during the day to see if you're taking really shallow breaths, and remind yourself to take some deep breaths. And this lower stress can do wonders for helping you feel more healthy and more calm as you are going through the sometimes stressful process of trying to become pregnant. You also want to know when to see a fertility doctor. So if you are 35 or older and you have been actively trying to become pregnant every month for 6 months or more, you should see a fertility doctor. If you are under the age of 35 and you've been trying to become pregnant for 12 months or more, then it's time to at least have a consultation with a fertility specialist. And okay, this next one, it's definitely not evidence-based, but engaging in enjoyable activities that at least momentarily help you forget how desperately you want to become pregnant can make the time between now and between now and taking that pregnancy test a little bit easier. Obviously, this is in addition to those relaxation techniques. And I want to be clear that I'm not trying to say, like, as soon as you just stop caring about getting pregnant, you'll get pregnant, because I'm sorry, but there's no way to trick your mind into that. And people that say that are so irritating. And I can almost guarantee that no person actively trying to get pregnant will say, once you just forget, then you'll become pregnant. And yeah, just ignore those people who say that, and just tell them that that's pretty much impossible and they're just talking a lot of BS. In addition to doing things to stay healthy, you can help ensure that you are setting yourself up for becoming pregnant by having sex around the right time of month, by tracking your ovulation with ovulation test strips. And you also want to then record each month when you have a spike in LH, or luteinizing hormone, which is what the ovulation test strips test for. And this can help you determine when you ovulate or release an egg, because the body has a surge in LH when you're ovulating, when that egg is being released. And once that egg is released, it can be fertilized by sperm if sperm is pregnant. Or if sperm is present. And women who typically have a 28-day menstrual cycle often ovulate about 14 days before the first day of the start of their next period. And ideally, you want to start having sex about 5 days before you suspect you're going to ovulate, before you have that spike in LH, as the egg is only able to be fertilized between about 12 to 24 hours after it's released, after you ovulate. So there's a pretty small window of time where it can actually be fertilized. And the good news is that sperm can survive in the body for up to 5 days. So if you're having sex every other day, starting about 5 days before you think you're going to ovulate, there's a pretty good chance that sperm will be present when that egg releases. And of course, that does not guarantee that you will conceive, but it significantly increases the chances. So if you have any questions about this or anything else about pregnancy, childbirth, early motherhood, go ahead and let me know in the comments below.